One of the issues people usually are worried about with all-on-4 or fixed hybrid dentures is that they don't know how they're going to keep them clean and are worried about the maintenance. I'm Dr. Rick Buck, and I've been a dentist for 17 years. With my instructions and with a little effort, I have found that this is not that big of a problem. So I'm gonna tell you what I tell most of my patients, and I'm gonna start by showing you results. Let me show you this patient. It's a patient that had a hybrid denture that I am taking out 10 months after I initially put it in. On the underside, you can see, or at least I can see, these are very clean. There is a little bit of film on both sides behind the back implants, but everything else looks very clean, and this is straight out of the patient's mouth. And just to give you a little perspective, this is less plaque than you would find on any given person's natural teeth in 10 months since their last cleaning. So I am not sure I would believe that you can't keep these clean, but here are my instructions that I gave him to help you keep yours clean. Brushing. First of all, you still have to brush your teeth at least once a day. Sorry if that's what led to losing the teeth in the first place, but there's just no getting around that. Why? To remove the plaque that can cause bad breath, staining, and most importantly, gum disease, which can cause the implants to possibly fail if you're not keeping them clean. I recommend using my Ezzy toothbrush for its ability to clean further between spaces, and especially small spaces and gaps, than other brushes. Flossing. Believe it or not, you still have to floss. There's no getting around it. It's for the same reasons as brushing, but this is where things can get a little difficult because you are using the floss to get under the bridge or denture and clean both its underside and around the implants that hold it in place. The thing is, you will need a floss threader to get the floss under the prosthesis. Doing that can be difficult, especially at first, because it won't easily fit between the gums and the prosthesis. So you have to take the time to learn where the best spots are to get the floss underneath the bridge. So you thread the floss in the floss threader, then you thread that under the prosthesis where you can move it back and forth. You then swipe the floss back and forth until it gets to the implant. You can tie a knot beforehand in the floss and thread that knot back and forth if you feel like you've caught something underneath the hybrid denture and you want to remove it. You can take that floss all the way out and then you move on to the next space in between the next two implants. You also have to clean behind the last implants, but that's easier because you don't need a floss threader. Now, I recommend using, once again, the Ezzy woven floss over other flosses that may feel better because Ezzy cleans better and more plaque. See my video on Ezzy expanding floss for more on that. Both the Ezzy floss and floss threaders can be found on Amazon, and I will link to them as well in the description. Once again, it takes time to learn where to insert that floss, but I would do that once a day. Peroxide. Peroxide is amazing and is sold for oral use at almost every supermarket. Peroxide is great for killing bacteria that cause plaque and bad breath. If you watch my daily tooth care routine video, I use it about every other day after flossing and before I brush my teeth. However, it is really useful around implants to kill bacteria. You don't want to use peroxide every day, so I recommend using it 2 to 3 times a week. There are 2 ways to do peroxide. First, you can buy what we call TP brushes or interproximal brushes. They're like tiny pipe cleaners that you can find on Amazon as well. What you do is dip them in the peroxide and then try to insert the brush right around those implants and brush back and forth with tiny movements. You do this on each side of each implant. Now, the problem is these brushes may not fit under your bridge if it is tight, but I would try these brushes at first. They come in a variety pack. Find the biggest one that can fit. Once you find the biggest size that works for you, then you can buy packs solely of that size. Now, if you can't get any of these that fit, then you may want to move on to the other way. Quickly, before I get to the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. Those dental products will give you a stunningly clean mouth. You should watch my videos about why they are the best, posted at the end of this video, so you brush and floss with superior results. This way is a water pick or water flosser. Now, what I'm about to say may break your water flosser, but it seems not to be a problem for what my patients have told me so far. What you do is you put water in the basin of the water pick and then you mix in some peroxide. There's no set amount or ratio that I have for you. In fact, It would be better if you didn't have to dilute it at all, but you'd run out of these bottles really quick if you didn't dilute the peroxide at all. So the more peroxide in your solution, the better. Peroxide can stain clothes, and these water flossers are messy, so I would do it before getting dressed. Then just find the tip that works best and get it as close as you can to the implants, because you don't want bacteria around those implants if possible. Remember, only do this 2 to 3 times a week. And I make no promise on if this will break your water flosser or not, only that it works for my patients. If you have a water pick, using it without the peroxide is a good thing as well. It's just not a replacement to the flossing, but it's a nice little addition if you can use it. Hygienist appointments. Twice a year, you should still be going in for cleanings by a hygienist. A hygienist will also help you know how to clean under your specific hybrid denture better. But what is important is there are 2 types of cleanings they can do: regular cleaning and removal cleaning. During a regular cleaning, the hygienist will try and get under the prosthetic to clean around the implants and the underside of the denture as best as they can. They may also use ultrasonic scalers to clean under them as well. The truth is, it is practically impossible to do a thorough regular cleaning underneath this type of denture. That's why I recommend once a year, or at most every other year, that we remove the prosthesis so the dentist or hygienist can thoroughly clean around the implants and under the dentures. Watch all my daily tooth care videos I have posted now for the best techniques, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath. My dental products are in Amazon affiliate links in the description below, and if in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.